Welcome to Pursue Wellness. This show is by chiropractors and for chiropractors, helping you with practical science for better patient results, physiology and labs, rehab and exercise, supplements and nutrition, unfounded trends, no opinions, just science. Let's get started.
Hello, I'm Dr. Callerina Woodard, and today I'm going to be talking about thyroid hormone. We hear about thyroid hormone all the time. And a lot of times we see patients come to us and they say, my primary care physician did blood work and they said X, Y, or Z about my thyroid. And we look at the blood work and turns out they only tested thyroid stimulating hormone, TSH. So today in this video, I want to cover more detail, the missing pieces that we have going on with our physiology if we're only looking at the signal, which is the thyroid stimulating hormone. There's so much more that is involved in a healthy thyroid production, thyroid hormone production. So let's get into it. I want to talk about the hormones that are involved, the whole physiology that's involved, the nutrition that can be involved, the stress physiology that can be involved with that, so that you can better help educate your patients and your friends and yourself on the full picture of a thyroid panel. Understanding the thyroid gland and the hormones that are associated with it is huge for understanding a lot of our patients' symptoms. There's a lot of research on the thyroid gland, and I know it's become kind of in and out of fashion for all of our patients to talk about it. I feel like all the years I've been a chiropractor, it almost comes in waves. I hear a lot of people saying, oh, my doctor recommended that I take something for my thyroid, and then it'll go away for a minute, and then it comes back. The thyroid can really impact a lot of the symptoms that we see on the day-to-day. That brain fog, fatigue, even joint pain, achiness, infertility is a big one that can all be impacted by how well your thyroid is functioning. And a lot of times in conventional medicine, they're only looking at one marker, which is the thyroid stimulating hormone. Now, this is still a very important marker. It's the signal coming from the pituitary gland or going back and forth in the pituitary gland. It's like a thermostat, giving us an idea, regulating how our thyroid hormone is functioning. But it doesn't give us the full picture, because someone can completely have normal thyroid stimulating hormone, TSH, but then have other issues causing the symptoms that they're experiencing. And nothing is more demoralizing than going to your doctor and hearing, well, your labs are normal. And you're like, well, it can't be my thyroid. When actually in reality it could. And there could be something, we could take it a step further, and there could be something that we see on lab work to address so that we can make a huge impact on your health overall. So why is thyroid stimulating hormone not enough? Like I mentioned, it's a signal, but it's not actually telling us what the tissue is doing when it comes to converting and using active forms of thyroid hormone. Because we have an active form, we have a adaptive form, we have an immune system upregulation form of these hormones that could all be playing different roles in what we're feeling. Stress, immune system function, your nutritional status, your training, your sleep, are all going to impact how well your thyroid hormone is actually doing its job to make you feel better. A little deeper into this, a more complex, better, we'll use the word better, panel for a thyroid assessment would be looking at, yes, the signal, your thyroid stimulating hormone, but also your free T4, that thyroid hormone, and then T3, both produced in the thyroid gland itself, but also how T4 is converting to T3 in other tissues, which I'll get into, as well as reverse T3, which is telling us how your body is adapting to stress, if it's overly adapting to stress, as well as antibodies. Now, this is a big one. Antibodies, not tested often, but I do see this more common than not, especially when women are at their wits' end trying to figure out why they're having so many fertility issues. Sometimes we need to take a look at, do we have some kind of thyroid antibodies present? Is there something going on deeper with the immune system that we should take a look at? So looking solely at thyroid stimulating hormone could miss some of these bigger things brewing in the background, because you could totally have anxiety, depression, brain fog, infertility, unexplained weight gain, but your thyroid stimulating hormone look normal. I see this often on labs. It's not until we take that deeper look at the T4, the T3, the reverse T3, the antibodies that really tell us, like, okay, there is some kind of underlying thyroid issue that's telling us we need to take a deeper look at overall what is your physiology doing. Thyroid dysfunction is really well documented. I actually read this book recently. It gets into the nitty-gritty of how actually a lot of medicated conditions, mental conditions, and people being medicated for anxiety and depression can actually be subclinical or even hypothyroidism causing their symptoms, because T3, the active form of our thyroid hormone, has a huge impact on mitochondrial function and neurotransmitter activity. So that being said, if the pituitary signal isn't exactly getting the full picture, but we have normal looking thyroid stimulating hormone, we could completely just not even look at what's going on with our healthy, active, metabolically based T3 hormone. And if that is underdeveloped, if we're not creating enough of that, we're going to have less neurotransmitter activity, less mitochondrial function, more weight gain, more holding on to toxins in adipose tissue, poor ability to detox and methylate. All these things can be related. They're all tied together into the thyroid's picture and how it's related to the rest of your physiology. So low T3 is often associated with impaired cognitive and emotional regulation, even if thyroid stimulating hormone, even if the signal is saying, yeah, it looks like everything's fine. We could still have all these issues going on and being left undiagnosed, and people end up on some kind of medication or treatment, or just being left feeling like hopeless when really it's a thyroid issue that we just didn't uncover. Now, how does the thyroid relate to fertility? So for me personally, I do see this more often. A lot more women do have thyroid issues than men, but it is present in men, especially these men that are overtraining and overworking and overstressed and not eating efficiently. But when it comes to fertility in women, your thyroid hormone does impact your ovulation, which is going to impact your progesterone, as well as your luteal phase and the endometrial lining. So your thyroid hormones can not only impact your fertility. So say someone comes and now they want to start getting pregnant and they can't. We need to take a look at the thyroid, but we also should be looking at this prior to trying to get pregnant. If a female comes in and they're having very irregular periods, very irregular cycles, a lot of PMS symptoms, that can all be impacted by how the thyroid is communicating to the uterus as well. And also, this was a big eye-opener for me years ago, how antibodies, our immune system's reaction, can cause recurrent miscarriages. So if you have a patient who maybe doesn't have a huge problem getting pregnant, they get pregnant, but they're having recurrent miscarriages, we need to ask the question, are there antibodies present? Because it's not necessarily that the antibodies attacked straight on to the embryo. However, it is a signal that your body, this person's body, as soon as that embryo is implanted, is not in a right place to be growing a baby, growing and nurturing a baby. Then if that person were to, because conception is a miracle and complex, but if that person were to be able to get past that stage and continue carrying that baby, they are at an increased risk for hypothyroidism during pregnancy. So all these symptoms that we know that later on could cause depression, anxiety, panic, worse brain fog when you're already in a hard time. This is so important for pregnant women. I don't want to spend so much time on this slide because I know that's not everyone's specialty. But for me, for my friends, for the women that I love, I always want to really take a detailed look into their thyroid, all the hormones as well as the antibodies, to one, see what's the root cause of their problem. I'm going to explain how this can be related to nutrients, but also what could be causing miscarriages, which is so heartbreaking and frustrating. But could it be that your immune system is just not in a place where it's going to allow you to carry on a healthy pregnancy? So thyroid function is completely system dependent. We convert the inactive form of hormone, T4, to T3 in our liver, in our gut, and in our kidney, our brain, and our muscles, this peripheral tissue. So if you've done a CMP and you've seen some liver enzymes that are off, there's more than likely going to be an impact. I say much more likely going to be an impact on this person's thyroid as well. So if someone comes to you, you did a CBC and you did a CMP, and they're also having brain fog, irritability, unexplained weight gain, hormonal issues, and you look at their CMP and you see we have some liver enzymes that are off, we have some bilirubin that's off, we have some stuff telling us that your liver is focusing on trying to heal or deal with these other issues. It's not focusing on the luxury hormone, which is a healthy thyroid. So this can give us a picture. I hope that makes sense. Also, gluten and your thyroid are very closely linked. The molecule that is within gluten is very similar molecularly to some antibodies that can impact your thyroid function. So not saying that I am super anti-gluten, but if someone's having these symptoms, if someone, especially if we know all you have from them is thyroid stimulating hormone and their thyroid stimulating hormone is off, it's low, they're chronically stressed, take them off of gluten, because that alone could be enough to help their body figure out signaling better. I say that alone, but they're also going to need some other support, but we have seen that that does have a huge impact on how thyroid function ends up working. So take a look at the gut, take a look at the liver, take a look at the muscles. If you're overtraining, if you're working too hard, if you're an athlete, like I've always been and I see all the time, if you're overtraining and underfueling, conversion of T4 to T3 in the muscle is not going to happen as well. So you're not going to have as much active T3. These are things to be looking out for. Stress, if you are too high stressed, you're also going to be producing more cortisol. Your body is always going to prioritize, our bodies are always going to prioritize survival over these luxury hormones. I don't know why I just grouped thyroid into a luxury hormone, but if we need to run and flee and get away from a lion, which unfortunately in our society today, we're constantly running and fleeing and getting away from lions, our body's not going to prioritize healthy metabolism, repair, and recovery, which is something that the thyroid hormones do. So take a look at these things, figure out what can we do to better our functioning of these other organs so that our thyroid can get better function as well. If you're drinking, if you're smoking, drinking alcohol, if you're smoking anything that we smoke, anything toxic entering your body consistently, just know that's going to impact your thyroid. Ultra-processed diets impact your thyroid hormone. All low-hanging fruit to help someone. The harder things are getting people to stop overtraining and eat enough. Because once you start eating, getting away from the processed diet, once you start getting away from smoking and drinking, now we have to look in the more specific, are you eating enough for your body? So let's talk a little bit more about nutrition. Your thyroid relies on enzymatic activities. And if we know anything about enzymes, enzymes are essential for hormone conversion, essential for so many things in our body, and are derivatives of protein. We have to have protein in our diet. I feel like poor vegans get picked on way too much in functional medicine. As long as you are getting enough amino acids, essential amino acids specifically, but all amino acids, your enzymatic activity can do its job. But all too often, we are not getting enough essential amino acids. Amino acids, let's talk specific for the thyroid. I don't want to get too much on other hormones, but tyrosine plus iodine, which our diets are really actually low in iodine. Like we're seeing goiters again on people. Those things are essential for thyroid hormone production and conversion. And we get these essential amino acids primarily from our diet. Yes, we can take an amino acid supplement. I take an essential amino acid every single day, twice a day. That's what helps my body heal. That's what gives me the extra bump I need. But I'm also eating 4-5 eggs a day, 3 to 4 servings of beef, chicken, or fish. I'm getting, my diet has a huge variety of protein in it so that I know I'm getting enough essential amino acids to be able to give me those building blocks, to be able to support the enzymatic activity, to convert these hormones and support my body's healing. Another big piece of this, and I have a conversation with patients all the time on carbs. I don't want to get too far off on carnivore versus this diet versus that diet. Here's what we know. Unless you are, I'm not even going to say unless you are. Here's what we know. Your thyroid requires carbs. I'll keep it simple like that. Carbohydrates, and I'm not saying cookies, I'm saying like berries, healthy fruits, potatoes, things like that, oats, fiber. Your thyroid gets a signal from your body when you ingest these things that, hey, we're safe. We have energy. We have insulin. And when insulin goes up, that's going to support that enzymatic activity for conversion. I'm talking about not insulin staying up. I'm talking about insulin going up, getting a little bit of a spike, calming cortisol down a little bit, helping the liver out. This also promotes anabolic activity and that we are safe, we can repair, we can recover. All those kind of signals happen whenever you are fueled properly. The main fueling source for your thyroid being essential amino acids and carbs, some sort of carbohydrate. So with energy and stress regulation, if we are in a calorie deficit, something we are often going to see is decreased T3, that active form of the hormone. With overtraining, I'm going to actually make this even broader. With a lot of stress, with overtraining, with oxidative stress, with ultra-processed foods, with a high sugar diet, with poor sleep, we're going to see an increase in reverse T3. And what reverse T3 is, I'm not going to call it a bad guy, it's a normal adaptive response to stress. But it acts like your regular T3, the active form, so that T3 can't do its job because reverse T3 has us on the brakes. It's the energy conserve signal hormone. It's the energy conserve hormone, reverse T3. So if we see reverse T3 really high, we know that this person is under a lot of stress and their body is adapting accordingly. See this a lot in athletes, and then they're wondering why they don't look super, super lean, or why they have just weird places of inflammation. This can all be because of overtraining, underfueling, too much stress in the body, causing the increase in reverse T3, a decrease in your active form, T3, and then you're going to have all of an increase in those symptoms of poor memory, brain fog, infertility, inflammation, poor digestion. All these things go hand in hand. I know I'm hammering this a lot, but it's something to definitely talk about. With chronic stress, we have the whole system downregulating. We have the whole system saying we are in conservation mode, we just need to survive. And that's going to alter that HPA axis. That's going to downregulate signal from your adrenal glands, producing that cortisol, and that's where we see a cortisol start to flatline. your thyroid stimulating hormone could still look normal, or it could also be low, telling the pituitary gland something's going on. We're downregulated. We don't have enough thyroid stimulating hormone. We don't have enough thyroid hormone. And chronic stress. But chronic stress can cause a wide variety of things. And there's so many ways we can see it on lab work. But honestly, a lot of just questioning of our patients can lead us in the right direction for that one. So let's just medicate it, right? When it comes to medication, and I know that a lot of people watching this video are in the same boat, or they have the same mindset of, well, I want to try everything before we have to medicate this. So a lot of times for the thyroid, and I've looked into this a lot, because the thyroid does have such a huge impact on us mentally and with recovery, sometimes people do need medication for this. Until we can take the foot off the gas, until we can calm the physiology down, we have to do something to at least keep them stable. So your thyroid, it's just responding to all of these inputs. It's not the bad guy. It's not the one making the decisions. Our patient is. We are. We're the ones stressing ourselves out. We're the ones not eating enough. Your thyroid is going to be dictated by your injury, your inflammation, how well you're eating, your nutritional status, your recovery, if you're overtraining, if you're constantly exposed to toxins, if you're constantly exposed to just all these stressors. And I mean, each one of these we could dive deep into. That's just how your thyroid's going to respond to these inputs. So when it comes to your sanity, when it comes to helping a lot with these symptoms, that's where medications do come into play. But we know when it comes to a medication, there's always a downside. There's always a side effect. My biggest thing that I push home to patients if they are taking one of these medications is, okay, you're taking this medication. We may be able to back off on that eventually, but we have to start signaling to your body that it's safe enough to produce its own thyroid hormone. So we have to address the nutritional need. We have to take our foot off the gas with training. You have to calm down. You have to sleep. You have to meditate. You have to address the underlying liver, gut, hydration issue. You have to understand these things first so that we can stop or back off at least on taking some medication to support your thyroid. The last thing I want to hit on is patterns that I see often when it comes to hormones. And I was going to just add screenshots and us go through, but I feel like sometimes the numbers get confusing. When it comes to different conditions, I don't see a lot of hyperthyroidism. Unless it's like Graves' disease and I can see it on somebody. See, in our society today, a lot more hypothyroidism. A primary hypothyroidism would look like thyroid stimulating hormone is high, your free T4 is low, and your free T3 is low. So overall, we're underfunctioning. And your pituitary gland is trying to say, hey, I'm turning up the signal to do something. Somebody down there do something. So our thyroid stimulating hormone can look high, but our active form and our form coming from our thyroid are actually going to be low. Then there's also the biggest category, which is subclinical hypothyroidism. This was the one that I actually have a lot of screenshots from patients' lab work for. So your thyroid stimulating hormone could be high, but then you have normal T4 and normal T3. So the pituitary gland is starting to get signals that something's going on, but the other levels are normal. Everything else looks fine. This is an early compensation pattern that the conversion is starting to lose itself in some places. Remember the places I mentioned conversion, of course, in the thyroid, but gut, liver, peripheral tissue. So this is signs that there's something going on that needs to be addressed sooner rather than later. This is where you want to catch people. This is where you want to sit someone down and say, let's talk about your nutrition. Let's talk about your diet. Let's talk about your exercise. Let's talk about your sleep. So this doesn't turn into full-blown hypothyroidism or Hashimoto's, where we have to look into a medication. Also, there's low T3 conversion, a conversion issue. So you could have normal TSH, normal T4, decreased active form, that free T3, and then more than likely increased reverse T3. Reverse T3 going up, if you don't remember me telling you it, reverse T3 going up in relation to stress input, overtraining, for fueling. This is a conversion issue where we have to start looking at more and more of the peripheral conversion. And is there something else going on? Similar to subclinical hypothyroidism, we can catch this before we have to do any kind of medication. And usually it can be treated by lifestyle alone. But then there's just pure reverse high T3. Normal TSH, normal or slightly high T4, normal or slightly low T3, but definitely high reverse T3. This is showing us that our body is showing a favoritism towards the reverse T3, which is the adaptive response to stress. And it's often because of cortisol, overtraining, underfueling, chronic stress, rough home life, too much stress at work. Reverse T3 is going up and up and up, which is going to eventually continue to take away from our free T3 active form of hormone. There's also more secondary hypothyroidism, where things can just everywhere be low. And that's because an impaired pituitary or HPA axis signaling. We need to look at stress with this one as well. And then especially autoimmunity. Now, these are the rare ones, but I have seen it before, that the normal thyroid stimulating hormone comes back and she's wondering, like, why do I not feel okay? Why do I keep having miscarriages? Because also my T4 and my T3 are normal. I should have all the doctors like, well, you should have all the energy in the world. You feel fine. You're in your early 30s. You're in your mid to late 20s. You should just feel fine. But thyroid antibodies are up. So the immune system is on high alert because of inflammation in the diet, because of inflammation in the body. Your immune system has a more likelihood to be more on guard. So now we have these antibodies coming into play, impacting your thyroid's active form of hormone. These are things that I like to keep in my back pocket to look for. I think it's so great to educate patients on this too. Educate ourselves. What do these things actually mean? And then how are they impacting your overall physiology? And how is your overall physiology impacting your thyroid? I know that was a little bit longer presentation about the thyroid, but honestly, we could go in even more depth. But as long as you understand that thyroid stimulating hormone is not going to give you the full picture, you need to understand the nutritional piece of this. You need to understand the active form of the hormone and how that active form, the free T3, impacts someone totally neurologically. Like, a lot of us are chiropractors. How is that going to impact our patient neurologically? How is that going to impact them as they continue to try to lose weight, as they continue to try to train? Being able to understand this full picture is huge. So I hope you enjoyed this. I hope you got something from it. I hope you continue to take this, dig into it a little bit more, take it to the next level whenever it comes to helping out your patients. Have a great day.